Hi, and welcome to Meet the Mayor. This is Larry Petraccaro, and I have with me Candice Davenport, who's the health officer in Maplewood, and Frank McGehee, who's the mayor. And Frank and I have been kind of co-hosting this show for a while now. But we thought we'd try to get Candice in here so we could talk a little bit about the consequences of the COVID-19 pandemic, and then also would like to learn a little bit more about the health department and some of its functions. So let me start with COVID-19. So Candice, can you update us on the impact of COVID-19 in Maplewood, and or Frank, whichever one of you can do that. You know, we've gone through this for what, about close to 2 years now, isn't it?
Almost 2 years, yeah, 20 months.
So, I mean, I know the last time we spoke, you'd given me some statistics on the number of deaths and so forth. I mean, has that changed? Have we improved?
Absolutely, yeah. So we have, one of our jobs, our core functions at the health department is monitoring how many cases we have and preventing the disease. So currently we have 1,984 cases. So we're nearing our 2,000 mark. Hopefully we don't get there, but we are monitoring it vigilantly. The number of deaths has slowed down significantly. We have lost 40 residents to
40?
Maplewood. Yeah, in Maplewood to COVID. But because people have gotten vaccinated, the vaccination has significantly slowed down the amount of hospitalizations and deaths that we've experienced. So that is good. So we will expect to see cases, and unfortunately we'll see a surge of cases during the holiday season because people are going indoors and getting together. But that is the status of COVID right now in Maplewood.
The 40 deaths that you mentioned, you know, the general assumption is that these are people that have had other issues as well, either older or people with underlying medical conditions. Has that been the case here, or have there been, has it deviated from that any?
Right. So earlier on, we saw a lot of elderly cases. COVID was affecting senior age population. Then we were also seeing people who are in their 40s and 50s who may or may not have had obvious chronic diseases. So it was a mixture of a bag of things, but a lot of the ones toward the later end were essential workers, people who had to go to work, people who were out there servicing the community while we were all in lockdown. So those are the people I'd like to acknowledge that we did lose. So those are the families that suffered.
You know, that's kind of, in a sense, you hit the nail on the head. The vaccinations, the mask wearing, the different things that we're supposed to do are not just to protect us, but in a sense to protect others.
Absolutely.
And I guess it's when you fail to recognize that
Yeah.
these things happen. And you're right about acknowledging these essential workers.
Yeah,
So,
40, you know, mothers and fathers and uncles and aunts and brothers and cousins and,
yeah.
you know, 40 lives tragically lost in a pandemic. And,
Yeah.
you know, and when working with Candice, and when she would call me and say, we have a death or another death, you know, those are difficult things to hear. And then there's difficult conversations that you have with those families when you call to, you know, express your condolences on behalf of the town of Maplewood.
Yeah, you're right. It's 40 people whose lives touched others and
Yes.
who are going to be missed by some number of people. Yeah, it's a shame. Well, so what is the current guidance in Maplewood in terms of, you know, vaccination, mask wearing? How does it impact, you know, the public employees, the municipal employees we have? How does it, and how do we interface? Do you have more responsibility for the high school, for example? Or I know the district is a combination of
Yeah.
two cities, but
Right.
and some of the schools are in one, some are in the other. But is there a uniformity of approach?
Absolutely. So Maplewood, South Orange are two towns that share one school district.
Yeah.
South Orange has John Festa, who is my counterpart health officer there, but we work collaboratively, pretty much talking every day. Our guidance is the same and consistent because we follow it from the state health department. And Dr. Taylor and the Board of Ed have been awesome, especially the school nurses. I want to give them a shout out for how great they have been in instituting and implementing it in all of their reopenings and how they're able to stay open and how they're having a successful year thus far because they're doing all these mitigation strategies. So in Maplewood and South Orange, I would say that we would both encourage people to get vaccinated. So vaccination is now open for children 5 to 11. It's
Oh,
a
is it?
huge game changer for the schools because once you get vaccinated, you don't have to quarantine and you can continue to go to school. So that's a huge, I think, impetus to get vaccinated. Of course, there's vaccination from 12 and upward, so adults and children aged 12 and up can get vaccinated as well. Masking, and this also applies to municipal employees, masking, we're encouraging in township buildings to wear your masks indoors. So even though we're vaccinated, we still take that precaution to protect one another because, you know, we do care about each other. So we would encourage people, when you're outside, you can take off your mask, especially if you're vaccinated. But if you are in a crowded setting with people you don't know, if you're a young person who hasn't gotten vaccinated, we would say please wear your mask, especially if there's going to be a big youth contingent around. And then if you're indoors and it's a crowded setting and you don't know who everyone is, we would also encourage you to wear masks if you feel comfortable. When you are going to visit family, as we're approaching the holiday season,
Yeah.
if more people are vaccinated, you can take off your mask as long as you're in a smaller setting and you're comfortable and you can be maskless with each other. I think it's just super important that people reconnect, and it means so much when you can reconnect with your family and your friends in a safe setting, and vaccinations, masks, being proactive about testing before getting together, all help.
Even testing, I mean, if you're all vaccinated, do you still think it's necessary to be tested?
I think, you know, we've heard some families choosing to do that
Yeah,
because they
yeah,
have
okay.
elderly relatives, people with immunocompromised, and they just want to be extra careful because we are having breakthrough cases.
Correct.
So it is important. And the breakthrough cases, you just never know how you're getting it. And you don't expect it because you're fully vaccinated. You think, like, you're fine. Unfortunately, we are seeing variants of COVID, which can break through, like Delta, the Delta variant. So people are being extra cautious.
Yeah, not unreasonably cautious
Mm-hmm.
either. I mean, I don't think, personally, I don't think anything that, you know, we've been asked to do is unreasonable. You know, I know, for example, when I get to the store, I'll always put a mask on. If I'm outside on a walk or anything like that, yeah, of course, it may not be necessary. And
Right.
it just doesn't strike me as a onerous request.
Right.
You know?
Right.
But I don't know if part of the issue, maybe you can answer me, it seems as if information is constantly changing.
Uh-huh.
Now, I guess it depends on your background. It doesn't surprise me. I have an engineering background, okay? So it doesn't surprise me that if you get different information, you might change what you're going to do. It's like if something doesn't work, you don't keep trying to do the same thing. If it's
Right.
not going to work, you try to do something different.
Right.
Right.
So, but I don't know if maybe there's a tendency to put too much faith in a pronouncement, or not too much faith, but to put sort of unflinching faith in it, if you know what I mean. It must be right, without recognizing that it may be right now, and tomorrow there may be evidence or circumstances that should tell you to change. Do you think that's any of what?
Go ahead.
Yeah, I mean, Larry, the answer to that question is cadence, right?
Cadence.
And what I mean by that is consistency. So when COVID first came out, especially in 2020, I sent out communications every day.
Yes.
Every day. So there was probably a string of 90 communications in a row for me. Sometimes, you know, as information evolved, and Candice and I spoke every day.
Yes.
You know, then we would reflect that in those communications to the public through email, through social media, through all means necessary to get it out to the public. Because information and being on top of what we were getting, be it from federal level or county or state level, was imperative for us to make sure that we got that information so we could take it, assess it, make decisions. You know, do we open town hall? Do we not open town hall? Do we have public mask in public settings? Do we not? Indoor, outdoor, whatever mandates we needed to do, coupled with making sure we kept you as a resident aware of what was happening in your community.
Yeah, that's important, and you know, I think you did it in a way that was understandable. I mean, you know, I'll watch these things on TV, and it's I don't know if I should call it jargon, but you know, sometimes you use language to confuse or to hide. I don't know if it's done intentionally, but you know, watching some of the medical professionals that they'll have on some of the different shows, they use language which they understand completely, but which may in fact not be clear.
Right.
What do you think that's? I mean, not part of what we did in Maplewood, but do you think that's part of what we might be seeing on a national level?
I think that sometimes scientists, doctors have jargon, like you said, that they speak all the time, and part of our job at the health department as a nurse is to translate.
Yes.
What does that mean to the average person? How does that in fact impact how I behave, how I travel, whether I go to school, how I interact with people, how I go to work? That's our job at the health department, is to take all of that information and make it clear so that we can function and get back to some kind of normalcy. And I want to get back to your original question. I think what you're saying is people want to hang their hat on science and just say, well, it was this and only this. But what people need to understand is that science evolves and
Yes.
changes, and we have to be more flexible and dynamic in how we respond to things. Our main goal is to keep everybody healthy and get back to some sense of normalcy, interacting with each other, going back to the businesses, traveling, doing all those wonderful things that we used to be able to do, but safely.
Yeah, and Candice hit it spot on. Like when we would look at our options on a situation, that we skewed conservative. And why is that? Because at the end of the day, we're talking about people's lives.
Yep.
And we'd rather be wrong on the conservative side than wrong on the on the non-conservative side. So, was it frustrating at time for some residents that we were a little tight on certain things or a little more strict? Yes.
Yep.
Did we save lives doing that? Yes.
Yeah.
Now, I'm glad to hear you both say what you said, because that kind of just kind of validates my opinion. In my opinion, it isn't a medical opinion, you know. So it's nice to hear that. And I think you kind of said something that really struck me. Is they want to they want a yes or a no.
Yes.
Yeah, maybe is a sometimes can be a frustrating answer. It's like, you know, I've often decided that the answer to almost any question anybody can ask is it depends, and that's kind of the situation that we're in a way.
Yes.
And the variants, we only have about a minute left, but this rise in the number of variants, is that kind of related as well to the vaccination level? Because
Absolutely.
Yeah.
Yeah, the more people and more spaces where people are that are unvaccinated, the COVID virus goes there and then mutates within that and then spreads. So this is how variants occur. The more people who are vaccinated, the more we insulate and protect the people in our community, and there's less variants that can be created within that. So that's really it in a nutshell.
And I would imagine, not knowing for sure, but I would imagine that that the evolutionary cycle of a virus is pretty fast. It's
Very
not
fast.
like 100 million
Yes.
years or something like that.
No, the virus seeks to survive. And so
Yes.
it'll do anything to spread to as many people as possible and disseminate itself and keep prolonging its life.
Okay. With that note, we're not going to be able to prolong this segment of the show because we're just about out of time. So if you'll stay with us, we'll be back in about a minute. So this is Larry Petraccaro, Candice Davenport, and Frank McGehee with Meet the Mayor.
It's an onion.
And welcome back to Meet the Mayor. Larry Petraccaro here with Candice Davenport and Frank McGehee. And we've been talking about COVID, just to kind of get an update on what's happened in the town and the restrictions or the recommendations and the requirements that we have to keep ourselves safe. And I guess the one big takeaway, just to repeat before we get started on the second half, is the whole idea behind the mask wearing and the vaccination is to protect other people as well as ourselves, to protect those we love and those we don't even know. So if you haven't been vaccinated, I'd suggest you get vaccinated. The second half of the show, I'd like to talk about the health department. I suspect that the health department is something that we either take for granted or probably know very little bit about. So between Candice and Frank, we're going to have a little more information about what the health department does, its functions, how it's administered, how it's utilized, and how in fact it impacts and helps us in the community. So with that, Candice,
Okay.
what's the health department do? We'll start with that.
Wow, so every day is like a box of chocolates at the health department. You just never know what you're going to get. We have 3 different sectors in the health department. So there is nursing, which mainly is is myself and our public health nurse, Anna Markarova. We do communicable and infectious diseases, so obviously COVID, but then many others like hepatitis B, hepatitis C, the immunization audits at our schools and our daycare centers. We do foodborne illness investigations. So all of those are things that we do at the health department. The second part is environmental. So our environmental health arm is run by our 2 inspectors, Peter Dillon and Emily Espinal. I just want to say we're a very diverse group. We have multi-ages and lots of experience in our group. So we deal a lot with foodborne food inspections for our restaurants in town, our pools, our camps, our daycares, our One Body Art location, our massage parlors and spas. All of those are licensed by the health department, and we do yearly inspections of those. All of the slow food markets, farmers markets, holiday fairs, all of those we help to oversee to protect people's food safety. We also do childhood lead prevention, childhood lead poisoning prevention in homes. I'd say the other part of us is health education. So as a health officer and the public health nursing supervisor and a health educator, education is a great way to inform people about what we do so that when we go out, we're educating, not just enforcing. And then it helps to empower people to know what to do and the right things to do. So when we do a lead investigation or we talk to people about garbage, it's all about, okay, it's not just about cleanliness, it's sanitation. Because if you have too much garbage, you will bring in rodents, and nobody wants rodents, right? It's a nuisance. So the last part, I would say, is our newest part, which is our social services.
Yes.
So we work with our welfare director, Beverly Ashman, who's been with the township for a really long time, but she's now folded into the health department, and it has been wonderful because we also get complaints, like in the wintertime, we're getting complaints of people who don't have any heat or hot water. And so we help with the code enforcement department to intervene and help people to acquire that. And then we connect them with our social services director, Beverly, and she helps them to connect to other county-wide sources and resources for families in need. So one of the things that I'd also say, which is new due to COVID, is we have a grant, and we received funding for a couple of positions. One is our Vulnerable Populations Coordinator, and that's Talia Jeffers. She responded initially, and it has grown, when we had a COVID case that needed assistance with food or medical needs, she would contact them directly and help them and connect them to resources. And that has expanded to other people who call us for other needs like heat and hot water or other issues, food, insecurity. And then we also have administrative assistance with Chrissy Macklin. So it is a big department. It's growing quite a bit.
Well, yeah, I mean, I thought it was a simple question. I'm wondering, do you ever get to watch TV at home?
No.
No, not really.
This is a lot of
I just
stuff.
wanted to say, Larry, that I think that as Candice laid out there beautifully, that our health department is robust and provides a lot of services to our township. And I think right now, and righteously, understandably so, people keenly focus on COVID and what we're doing to manage and lead us through this pandemic. But outside of COVID, there's so much more that the health department is accountable for in keeping us safe, healthy, and well
Yeah.
in our day-to-day lives in the township of Maplewood.
Yeah, I would also like to say we also do flu clinics, the township flu clinics. We also try to encourage people, like while you're walking around and pedestrian safety in the dark, we try to encourage that. We also do Municipal Alliance, which is drug and alcohol prevention, especially for our youth. So we do that and a whole lot more.
What I thought, what I couldn't help but think is, as you're explaining all this, both of you, is the way that health has been integrated over so many levels. It's not just not being sick, or not being physically sick. It's I guess the psychological benefit of knowing you have support,
Yes.
of trying to do so many other things. And I don't know if holistic is the right word. It's one of those
it's my favorite
jargon
word.
things. But it strikes me as it's so comprehensive, trying to deal with the whole person, the whole environment, not just the viruses kind of thing.
Right. We try to move away from illness focus and that medical model, but really focusing on the whole person and the whole community. The health department does the work, but we are looking always at our resources, our partnerships, how to fold in other groups and organizations that have other resources that we can provide. That's our job at the health department in Maplewood, is to get Maplewoodians the care and services that are out there that they may not realize.
And it must be, in a sense, almost an exponential improvement. The fact that you're not dead-ending the inquiry that comes into you, but that you're looking to put it into the right location. I mean, that's one of the more frustrating things, dealing with, if you call somebody up, maybe all you want is a pair of pliers. I mean, this is maybe a silly analogy. And he doesn't have it. The store may not have it, but they might have something that works perfectly well, but it doesn't get that far. So you're really not completely healed, if you want to look at it that
Correct.
way. You only got part of what you wanted.
Right.
You mentioned vulnerable populations. What are some of these vulnerable populations? Or maybe it's general, I don't know.
No, so due to COVID, I think it really highlighted those people who were vulnerable, people who don't have access to healthcare,
Correct.
people who don't have access or have a hard time with transportation, people who are food or housing insecure,
Correct.
People who are on the verge of homelessness, people who lose their jobs, and then subsequently, because of all of these downturns in their life, look to substance use. And so who are those who are isolated due to COVID, those who say, I can't do this by myself, I can't take care of myself, those who are caregivers of sick people, who have the burden 24/7 of care all the time. These are our vulnerable populations. But I'd also like to say, even among the healthy people, we have people who are still vulnerable. Like they don't have health insurance.
Right.
They're on the gig economy. They're working 2 to 3 part-time jobs. They're hustling and they're bustling and they're raising families and they're trying to be part of the community. And then they get sick. And then what happens? And so our job is to connect them to signing up for health insurance, getting them to a doctor who can see them instead of going to the ER. Finding someone who can speak their language so they can translate all of those things, championing resources and access for those who are disabled. So these are all the people that we try to bring to the forefront of policy decisions.
Just curiosity, how many different languages do you have to contend with?
Oh,
It's kind of off the track, but I'm just curious.
lots. Mainly in Maplewood, we have Haitian and Spanish.
Oh, yeah.
Yeah, Haitian Creole and Spanish. Mayor McGehee definitely knows how we're trying to outreach,
Yes.
to those populations. But we get the occasional, Chinese and Hindi and other types. But we also use the translation services through the State Health Department and through Rutgers, and they help us out a lot.
It's amazing. And all these inspections you have to do, I mean, there are a lot of different places in town. And so this must be ongoing. You kind of schedule that and coordinate that?
Yes, we have a schedule. Luckily, our efforts are kind of seasonal, so we know what to do, and our staff is very professional. Speaking of multi-languages, we try to build the diversity into our workforce. So Emily Espinal is bilingual. She speaks Spanish and English, which really helps when you're talking to businesses, especially restaurants, that have staff that speak other languages. It sure makes a big difference when they're like, oh, that's what you were saying.
Yeah.
Yes, and then everything works out. It's healthier.
I run into that little bit, not in town, but I help out with some stuff, and occasionally someone will come up who speaks Spanish,
Yes.
and I'm at a loss. And,
Yes.
and to your point about you can just see when someone can speak their language, how they just open up to
Yes.
that, how
Absolutely.
it's so much absolutely better.
Yes.
So I think that's wonderful. How do how do you publicize some of these things? We have about 2.5 minutes left, but how do you publicize? Where should people go if they want to understand some of these resources?
Right. So one of the things that they can do is contact us. We've been in town hall and throughout the entire pandemic. So they can call us at town hall. They can go to our township website and just go to departments in the health department. Christy Macklin has worked on our website, so she's made it very organized and easy to follow, thank goodness. People can go on, we also try to push stuff out through social media. The mayor and the township committee and our department tries to push stuff out that way. But I was also mentioning that we have a weekly community resource e-blast that we send out, and it has a whole slew of information. So if people want to sign up to receive those, they can contact us at the health department, and we can get them on that email distribution list.
Oh, that's great. And what about, you mentioned food insecurity and things like that, and I know there's some volunteer organizations. I know you've been involved in some of them, some of the food
Right.
pantries and things. Do you also enlist volunteers to help, like deliver meals and things of that sort?
So we know definitely of people who do that, and we can connect them,
Okay.
volunteers to them. Like Soma Shares is a volunteer group, community group. MEND, or Meeting Essential Needs with Dignity.
correct, yep.
They have volunteers. We partner with them, so we definitely will send people their way if they're looking to volunteer. One of the things I want to mention is we have a summer meals program that we've been
Yes.
working with for the last
Crest.
3 years with the Township of Irvington. Maplewood is a satellite, and for 3 years at Maple Crest Park, over the summers, we have been providing close to 300 to 500 meals over 5 days a week to
Awesome.
children 18 and under and those who are disabled. And that has been phenomenal. So we're
Awesome.
always looking for volunteers
awesome.
to assist with that, and that's 8 weeks in the summer.
And that'll be continuing in this summer?
I hope so, yes, I believe so. It's a USDA program.
Yep.
That's,
Oh,
again, all these things, I didn't know what to expect when we had the conversation, but I didn't expect to be overwhelmed.
That's a lot. That's
And
why
that's a
that's
lot
why
of
kids is here.
stuff.
I want people to
And
see.
I think, it's great that this is available to the community,
Yeah.
and now the community has to, and I'm sure there's people out there who had no idea about some of these things who'd probably be
Sure.
delighted to help out in the summer.
Absolutely.
With the,
Volunteers.
and that probably helps some of the free and reduced lunch kids as well in our
That's
system as well.
Exactly right.
Okay, well, I think it looks like we're just about out of time, so I got to thank you, and I'll tell you, those of you that are paying attention, the health department does a lot more than just stick shots in your arm, so let's keep that in mind. So Candice, thank you
It's a
very much.
pleasure.
That was
Thank you.
really illuminating, and Frank, thank you. We really
Candice
appreciate it.
is a star, and so happy that we had Candice
Absolutely.
on today. So
Thank you so much.
Thank you for joining us on Meet the Mayor.